You're up.
So what we started to do last year is take advantage of the audience that we have. We could reach all the employees doing this fire training. So we take some of that time that used to allocate for fire training and we talk about another important topic that affects the safety of the employees, our visitors, and more importantly our patients, and enable us to provide care for our patients. Last year we started with the active shooter, and this year based on some actual incidents that we've had in the hospital, outside the hospital, off-site centers, and based on our EOC tracers, we thought we would cover hazardous chemical release. And when I talk about that, we're also going to talk about the MSDS sheet, and we're also going to be talking about activating the emergency, code yellows and code grays. So when I think of these responses, I go right back to the Joint Commission standards. I'm going to be walking all over, so you could just keep the camera there. It'll be easier. So when I think of Joint Commission standards, I think of 6 different elements. So every time we have an emergency, probably some of the most important things that we do are communications. So when I think of communications, I think that's a huge failure. The other thing I consider safety and security. So I'm thinking safety of the patients, safety of the employees, and security of the facilities. Utilities management, that's from everything from your ventilator to your CPAP, your BiPAP, to electricity, to flushing your toilets. Last year we experienced a failure of the utility system and the water main broke and you couldn't flush toilets. That caused a little bit of chaos upstairs in the doctor's office because they have somebody coming in with C. diff, an uncontrollable explosive, you know what, it makes it difficult to handle that patient. So that had a huge impact on this facility and your ability to care for the patients. That, in a sense, was a code yellow. That was a disaster because we have to think of, can we stay open, can we operate and take care of our patients adequately? When I think of all this, I think of the resources and assets that we have. Okay. Some of the resources include personnel, equipment, and supplies. So when you think of resources, think of personnel, equipment, and supplies. What do you need to deliver the care for your patients in a safe manner? Now, when you respond to such an incident, what are your roles and responsibilities? Andy covered that when he talked about fire, responding to a fire drill. So what are your roles and responsibilities during a disaster? What are our goals? Provide good patient care, right? Provide clinical services to our patients, and support all the other ancillary departments that help us provide the clinical care. They can be everyone from materials management, facilities, as well as the folks from environmental care and food services. So it's really a group effort to support patient care. So what's an emergency? These are some of the objectives we'll cover. We'll talk about what examples of emergencies. We'll talk about activation of the response, as well as learning how to use the MSDS, or what we should be calling the safety data sheet. One of the things we do in the tracer is we go through and we ask people to look things up. And this is the one item that everyone's been getting wrong 100% of the time. So I do the EOC tracer and we'll ask somebody, hey, can you look up this chemical? They can't do it. We have to talk to them and show them how to do it. And that's something that OSHA requires us to have the ability. More importantly, if you're the one exposed to a chemical, wouldn't you want your coworker to be able to look it up quickly and not fumble around? So we're going to review that whole process. So when you respond to a hazardous spill, it is the utmost importance. You want to isolate the incident and you want to do the proper notification. And you could take this and apply it pretty much any emergency. Safety is the most important thing. You want to isolate and you want to notify the folks. So some internal emergencies that I think of: code blues, code pinks, code orange. And if you're not familiar with code orange, that's a new code that was developed a little more than a year ago. That's our Ebola response. It's a 2-tiered response for our hospital. The first tier is the leadership staff. The second tier is the healthcare providers delivering the care. So similar to how we do a hazmat, that's how it's been modeled. So hopefully soon, when we get hazmat capabilities at this facility, you'll be doing some of the same training. So what else do I think of? Rapid response team. So if you work at Charlotte and you were in even here, if you have an incident where somebody has a syncopal episode, getting their blood drawn, somebody passes out in cardiopulmonary, that's an emergency response. That, in a sense, is a rapid response. Now, when you respond there, everyone has a role and responsibility, and they should know what their responsibilities are. So let's talk about some other things that affect the hospital. Oxygen. So if you have a failure of the oxygen system, that can impact the facility significantly. Hazardous chemicals or spills. And then when you think of large plumbing leaks, we can go back to an incident that happened at Charlotte maybe about 15 years ago. There's this water main up on the 6th or 7th floor. When it broke, there's thousands of gallons a minute coming down. And that center stairwell had so much water that if you took a kayak, you could have floated down to the bottom of the stairs. Some people said, hey, if there was salmon would have swam up to the 7th floor. That's how much water was coming down the stairs. So we talked about some internal codes. Now we're going to talk about some external codes because they may impact your facility, though you may not be receiving trauma patients. Anytime we have a mass casualty incident, we have to be prepared for a surge of patients into the hospital. So examples include in New Hartford, in this area, we had a crew team doing crew, and 16 people, 18 people, when the boat capsized, they were in the water. So when I look at that, the time of year it was, the weather, the severe storm, now we have potential 18 victims that might be going to our local and area hospitals. What about hazmat situations where we have a hazmat plan? We developed one for this facility. We also have a hazmat plan for Charlotte-Huntingford Hospital. So we trained and we practice our hazmat response. Radiological emergencies. We recently, not recently, maybe 4 or 5 years ago, we had a region-wide drill. We looked at radiological responses. One hospital learned that if they don't isolate the incident and isolate the treatment area, they can contaminate their hospital. We'll talk about that in a couple slides. Infectious disease. When I think of infectious disease, I think of MERS-CoV, I think of avian influenza, and I think of Ebola. So when you think of Code Orange, I want you to think of infectious disease. So now we think we have an emergency. We identified an emergency. That emergency compromises the safety, it compromises our ability to provide care for our patients. If you're thinking about evacuating this facility because of something, that's an emergency. That's a code yellow. So we pick up the phone, we activate code yellow, or if it was an external incident, we would activate a code gray. So state the emergency. Use plain language. In our ER at Charlotte, if it rains really hard, the rain comes in from the outside of the EMS entrance, and it actually starts to take over up to 4 rooms. And when I say it's crazy. So what would I do? Now, when I'm thinking about this, I'd simplify it. Pick up the phone, dial 4000, activate code yellow, because what's usually they're trying to do? Calling people. Oh, I need that. And everyone's on the phone. Well, I'm doing this, I'm doing that. Guess what? We have an emergency. It impacts the safety of our patients, impacts the care, the delivery of care to our patients. That's an emergency. That's a code yellow. The team responds, and then you get the help. But we want to use plain language. Code yellow, flood. If you're in the process of evacuating patients, like we experienced a release of a chemical, a pipe burst in our walls at Charlotte last month, and when that chemical was pouring out, it was being pumped out. So it was coming out hundreds of gallons a minute. As it was coming out of the pipe, the nurses made a really good call. Get the patients out. So they were looking for patient safety. They did an evacuation. But what did they do? They called, oh, I need this person, I need that person. They didn't pick up the phone and call a code yellow because they didn't feel comfortable with doing that. So we want people to really lower their threshold, activate a code yellow. The nursing supervisor was on her cell phone. We couldn't reach her because there's a lot of dead spots in that cell phone. So we put mechanisms in place to kind of hopefully that won't happen again. So what did we do? We had a code yellow. So what should have happened, and what's going to happen from now on, they call a code yellow, and they say, hey, we have a flood or a hazardous substance, and I'm evacuating patients. So now overhead, it'd be code yellow, hazmat, evacuation. So people hearing it will respond, and they'll know what the help is going to be needed. Now, when you think of the folks responding, you also think about the rest of the hospital, the rest of this area, is that now you have a situational awareness. So if the announcement's made overhead, by you hearing that there's an incident going on in the ER, you're going to change how you do things. So in the hospital, and even here, is that the time for a coffee break? Absolutely not. That's a time to kind of step things up and help. In the hospital, we're going to be expecting floors to take patients from the ER. If it's a code gray for the ER, we're going to expect, if it's an evacuation of a floor, whether it's horizontal or vertical, that other floors are going to prepare to take on patients quickly without a lot of warning. So that's the time to set things up. So that creates a situational awareness. So I don't need you to respond, I need you to be aware of a problem. So the overhead announcement really works well. So we think of small spills, and I had the opportunity to look at a small spill policy, and it was so complicated that I had trouble reading it and understanding the definition of a hazardous substance. So when I put together the large spill, and when I say large spill, it could be 2 gallons of a chemical. That has an impact on the care, because if it's something hazardous, that could be very dangerous. So when I think of a spill and it's hazardous, it could be a liquid, it could be a dust particle, it could be a solid something or other, and it could be in gas form. So when I think of hazardous substance, it's something you don't know what it is, and it impacts patient care. Play it safe, and we want you to think of safety. So what's happened in past experiences at Charlotte? And these same experiences will impact this facility too someday. If it hasn't already, you may experience the same thing. So we've had motor vehicle accidents. This one case, there was a woman driving her car. She took the pesticide, put it in a box, a shoe box. Not sure why, but she did. Well, she got in a car accident. The car rolled over. Now she's got white powder on her. EMS responds. What do? Go in the car, take out the hurt person. They put on the reserve. Now they realize what is going on. They don't know what the chemical is at this particular time. They found out quickly, so now you got the fire department on scene because they're there for the car accident anyway, so they're additional resource that was helping. Well, they took the patient, took her clothes off, and hosed her down. They did a decon right there in the scene. Well, it's a hazardous something. It's a pesticide. They bought a little bottle of it at Home Depot. Guess what? Now they have to call the DEP. Now the DEP's on scene, so what are they saying? We'll follow you to the hospital. And when you get to the hospital, you have to put her through decon a second time. Though the lead fire person said, hey, she's fine, she's not a hazard, DEP said, hey, wait, I'm the authority here, you're going to do another decon. So now we activate our hazardous response plan. Now we're doing decon. The catch was now we got 3 other people we have to put through the decon process. 2 EMTs and the paramedic. All their equipment in the back of that ambulance, the ambulance, going nowhere. Now they're out of business. Now they're parked off to the side. So now we have the safety and security not only of our patient, but EMS responders and first responders. Then to throw in a mix, now the ambulance is in our parking lot until it got decon. So this started around 3 o'clock, it ended almost at midnight. 1 person, really simple, not severely injured. That's a lot of resources and it took a lot of time. In your case here, you're so far away, you want to activate the resources sooner than later because you may not get anyone from Charlotte for up to 20 to 30 minutes. So the sooner you activate resources, the sooner you're going to have trouble. So you don't want to wait until you're underwater. You kind of want to wait until you recognize the emergency. Chemical spills. We've experienced a lot of chemical spills in the community. One of them included a company that was decommissioning their factory. In the process of doing that, we're working on the plumbing, and the plumbing had a pretty hazardous chemical. I'd have to say that company did a really good job of having the MSDS sheet, reading it, and having a contingency plan to what to do if they're exposed. They also had the individual wear a heavy-duty raincoat, so when the chemical did splash all over him, his exposure was minimized. They had the neutralizing agent because they looked it up on the MSDS and they poured the chemical over. But guess how they arrived to the hospital? They drove in a car. That can happen here. So what are you going to do when somebody arrives in a private vehicle after they've been exposed? 85% of these people will just show up without warning. They don't show up with EMS because we have an EMS plan and they're not going to come here. Our plan will always be they go to Charlotte. We have more resources and the ability to take care of somebody who's been exposed to a hazardous substance. Another incident happened on Route 8. It was going from Thomaston to Torrington. A big tanker truck carrying gasoline. You know how huge those trucks capsized. You probably heard about it. Probably the biggest gasoline spill in all of Connecticut, and it happened in the northwest corner. Now, the truck's on its side. Thousands of gallons of gasoline are pouring out of that truck, and the driver was drenched. When I say drenched, it's like you took a sponge, put it in a 5-gallon pail, took it out, and it's dripping wet with gasoline. So the nurse working night shift, again, night shift, not a lot of resources, was listening to the scanner, so she had a situational awareness. She knew something was going on out there in the community.